via, and so God has allowed us to make our acquaintance, and I sincerely hope to get some things done with Brother Jeff and Brother Richard. Now you translate that message back to them. Amen. Now, ushers are giving the papers out. Ushers, when you all have given all the papers out, let me know, and then we're going to put them up for the presentation, and you can hear what United Healthcare has to say. Amen. I think we're just about there. All right. All right, and I think you brought some other items that they're passing out. Okay. Ushers, just give me a signal when you all have passed out everything that you needed to pass out. We're ready? All right, let's give Brother TJ a warm Mount Nebo welcome. Come on, let's give him a warm. You can pull that mask off, and if you're talking to the mic, they're going to give you the volume that you need, and you'll be able to be heard all over the sanctuary.
Okay.
All right.
Pastor Harvey, thank you very much. And Mount Nebo, appreciate you letting me have a little bit of your time this morning. You actually may know, I texted my father last night, and I said, Dad, do you know Pastor Harvey? And he said, of course I do. I preached at Mount Nebo. Reverend Thredris Jones. Yeah. So it's always a pleasure to be in the fellowship of the saints. So thank you once again. My name is Thredris Jones. Call me TJ. I'm an agent with United Healthcare. Been with them for the past few years, and just here this morning to talk to you about a program that we rolled out back in the fall of 2017 that provides some great benefits to the individual enrollees and communities as well. So we are making our rounds, so to speak, to just inform folks of the plan, the program, and some others that we have available with United Healthcare. I'm going to assume that there are some here today that are Medicare recipients, and you may already have a United Healthcare plan, and we thank you very much for your business and support. I want to offer myself up in that regard as well, that if you are a current member of a United Healthcare Medicare plan and you have questions or need service of any kind, please reach out to me. I would be more than happy and willing to help. I believe the ushers have passed out brochure, business cards, and then those 2 flyers, and that should have my name and contact information on them. If you look at the, just follow along with me, and I'm going to be very brief. This one page here that says get more benefits up at the top, we'll just kind of talk through that. So the plan that we're discussing today is the United Healthcare Dual Complete plan, and it is for folks who have both. If you look in that top right-hand corner, it is for folks who have both Medicare and Medicaid. So Medicare and Medicaid recipients would be eligible for this plan. Now, if you just have one, that red, white, and blue Medicare card, then we're still able to help, just not with this particular plan. So again, both Medicaid and Medicare recipients are eligible for this plan. So what this plan does, it's a no-cost plan. There's no cost to the enrollee. That is picked up by the state of Nebraska, the cost for that plan. And it simply adds more benefits, as the flyer states, to what you currently receive. It does not take anything away from what you currently, or what a person currently receives from Medicaid or Medicare, it just simply adds to. Some of those extra benefits include we give $1,200 a year, and it rolls out every quarter. So every 3 months, the plan distributes $300 to purchase over-the-counter pharmacy items. So your products like Advil, Tylenol, cough and cold medicine, those kinds of things that you go to Walgreens and buy from the pharmacy that are 2 times the price of what they probably need to be, we give you the money to get those items. Okay, so again, $1,200 per year. That's $300 per quarter that we give you to purchase over-the-counter pharmacy products. Prescription drugs. We all know, those of us who take prescription medications, they come at a high cost. So on this particular plan, there is a $0 copay for your prescriptions. All covered prescriptions are covered with a $0 copay. $2,500 per year on covered dental services. And this particular plan offers a comprehensive dental benefit, which simply means it's going to, there's nothing that it won't cover, from cleanings to fillings to dentures to implants. $2,500 per year goes towards the dental. And then we do have the Renew Active program. Those, again, that are currently participating in a Medicare plan, you've most likely heard of the Silver Sneakers program, which is a gym membership. We were part of the Silver Sneakers kind of network, and then we broke off from that and created our own called Renew Active. So it's the same benefits as Silver Sneakers, the same gyms, probably a few more gyms here locally that participate in our Renew Active program. And again, that comes to you free of charge. I'm not going to go over each benefit because I know it's about lunchtime. But on that second handout that you have, the two-sided handout, you will see all of the services offered in the plan listed, and what you will see in terms of cost is $0. So again, this is a comprehensive health care plan that covers everything in terms of your medical, doctors, hospital visits, as well as dental, vision. There's your prescription benefit, as I mentioned, and a host of other benefits as well. There will be some slight changes and changes to the better in this plan in the upcoming year. So legally, technically, I cannot discuss those benefits until the 1st of October, but I can say for those that are eligible for this particular plan, the United Healthcare Dual Complete, there's more to come in terms of benefits. If you have any questions, or if you are eligible and you would like to enroll, my contact information has been given to you. Please reach out, and I'd be more than happy to speak with you. Also, and in closing, if not everyone is eligible for this particular plan. Again, Medicare and Medicaid you have to have. But if you just have Medicare, just have the red, white, and blue card, we are still able to help. We have a multitude of plans that are available to folks who just have Medicare, and they're good as well. So, again, thank you so much, Pastor Arvey. Yes, sir. Mm-hmm.
Now, he's distributed information via paper and via talk mouth, but there could be a question of
yes.
2 or 3 or 4 that needs and wants an answer. So if you have a question, just raise your hand and he will address you.
Yes.
And you give the question and then he'll respond.
Yes, brother.
Is any of this based on income?
Yes. I think the short answer to that is yes. The reason I say it is income-based is because the Medicaid portion is an income-based program. So to qualify for full Medicaid, which is what you need for this plan, you would have to earn under a certain monthly dollar amount. And that's going to lead me into a little bit of a segue. Medicaid, what Medicaid doesn't tell you up front is that you may be close to qualifying for Medicaid benefits. Maybe you're $25 over, $50 over, even $100 over in income. I have folks that I work with that are literally a dollar. Worked with a gentleman just this last week, 99 cents over the income threshold to qualify for Medicaid. Well, if they just come back and tell you, oh, well, you make too much money, and they don't give an explanation, then you wouldn't know that there is a way that you can spin that income down 99 cents or $20 or $50 for you to get to gain full Medicaid. So if you do not financially qualify for full Medicaid, let's talk. Let's see exactly where you're at. You may be close, and we can help get you under that threshold to qualify. Yes, sir.
When you say prescription drugs, and they are supposed to be cold-free or whatever, are there tiers, like tier 1, 2, and 3?
Yes.
Is all of the tiers free or just 1 or 2?
It's a very good question, sir. All of the tiers under this program are at a $0 copay, so long as the medication is covered. So we have a pretty lengthy list of formulary medications, are what insurance companies call them, and every insurance company has their list of formulary medications, be it United Healthcare, Aetna, Humana, Blue Cross, Blue Shield, whoever it is. So as long as the medication is covered under this plan, then it would be at a $0 copay. Mm-hmm.
Any other questions?
Yes.
This plan was just a lot of people on Medicaid, right?
Say that again, I'm sorry.
People that are on Medicaid.
Oh, yeah, it applies for folks that are on Medicaid and Medicare. So you would need the two. Yes.
Any other questions? I will say this, and I don't know if you can at this time address it. I know Douglas County Health and Human Services, some stuff is coming down the pipeline as to what you referred to October 1st that will be beneficial to a certain age population. Mm-hmm. And I don't know if you can go a little bit into that or not.
Yeah, I'm not familiar with that. I know within the last year, Medicaid has, and that's the state, not the county, but that Medicaid has expanded its coverage, so to speak, so more people qualify. But I'm not quite sure what the county is rolling out.
Well, keep your ears open. Mm-hmm. Keep looking. There's some stuff coming down that's going to be beneficial to our people who are at a certain age. Mm-hmm. Are there any other questions? Any other questions? Right.
Yes, ma'am. The age to qualify. So in general, over 65 and over would qualify. However, I work with a large number of folks that are under 65 that have both Medicaid and Medicare, and the reason they qualify is that they receive Social Security disability income. So if a person, regardless of age, is receiving Social Security disability income and they have done so for 2 years, 24 consecutive months, then they are awarded Medicare Parts A and B. And generally, they are awarded Medicaid as well, kind of as part of that SSDI package. So, thank you.
All right, any other questions from anybody? All right. Brother TJ, I'm about to, come October, I'll be 11 years away from qualifying for all of that.
All right. I'll put
I'm
your
gonna
name
need this
down.
information in 11 years. I'm getting closer. I'm much closer now than when I came to Omaha.
Amen.
I came to Omaha, I was just about ready to turn 38, and now I'm just about ready to turn 54. Amen. Give Brother TJ a warm Mount Nebo. Thank you, man. And I have not met your dad personally, but preacher to preacher, I know him. I've spoken with him over the phone a few times, and we as preachers.